This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with Tina Fries-Decker, the president and CEO of Corewell Health, about the leadership skills that are critical in managing a merger. We've talked with Tina at least every couple of years since Catalyst was formed, because I think Corewell is one of the most forward-looking payer-provider systems in the country. And that's probably at least in part because Tina is one of the country's most forward-looking CEOs. Tina spoke at the JP Morgan healthcare meeting in San Francisco in January. And at one point, she discussed 5 leadership skills she considered critical to managing a merger. I looked around the room and I saw that everyone was listening. No one was doing email on their phone. So I asked her afterwards if we might review them for the NEJM Catalyst audience. So, Tina, let's start with a brief description of Corewell today, and most critical to our discussion, the merger that you have recently undergone.
Thanks, Tom, and I appreciate your kind words. As you saw me at JP Morgan, I'm one that really gets back to who we are and why we exist. And so Corewell Health is 65,000 people taking care of Michiganders. And they're taking care of people like Timmy and Anna, who were involved in a very serious car accident and airlifted to our children's hospital. And it was very scary. Timmy was presumed dead at the scene. And after 12 surgeries, a coma, traumatic brain injury, and more than 20 broken bones, it was amazing to see him survive and walk into our children's hospital the other day. And that's what we do. We provide compassion, we provide exceptional care, we do coordination, and that's the amazing thing that our team brings together. And so when I think about Corewell Health, we are so much more than our 21 hospitals, from rural to urban to suburban, critical access hospital, of course, the children's hospital. So much more than physician practices and our 300 plus ambulatory sites. It's the people inside all of those that are making a difference. And the unique thing about us is that we have a health plan, Priority Health, which serves 1.3 million members in all product lines, governmental and commercial. And we are working together to really help people be well, to provide better care for our communities. And it is an amazing honor and a privilege to work with those 65,000 people.
Well, can you give a high-level description of the reasons for your recent merger from both sides? In other words, why was it a good thing for what we used to call Spectrum, and why was it a good thing for what we used to call Beaumont?
I remember feeling so disheartened in the pandemic when we saw and experienced the disparities of care. And this instilled in me this vivid passion and drive to ensure that we were taking care of everyone in Michigan. I knew we wouldn't be successful if we only cared for one side of the state, which is what we did prior to the integration. And I knew we needed to collaborate, and we needed to do this for the people that we were all serving, and had to do it so much better. So that's why I approached Beaumont. I felt that our state deserved something better, and we needed to define healthcare excellence at the state level and ensure we were living up to that, because no more Michiganders should die or less quality, compassionate, equitable care because we were not coordinating and very focused on serving our communities.
Well, those were good reasons for merger. What were the barriers that you had to overcome?
Oh, there's lots of barriers. When you think about it, change is hard for everyone. Integration is emotional and it's disruptive. It's a huge cultural shift. And for us team members, they had to get used to being Corewell Health versus, Spectrum Health or Health. And so we each have lots of pride within our area, and I want that level of pride for the entire organization. But I also recognize that it takes time and it takes trust. I also know we have a lot in common. Our passion for compassionate care and our passion for people is what brings us together. It's our purpose. It's the heartbeat that continues to move forward. And while we may have different approaches, the goal is the same. And so that's our opportunity. We can learn from each other. For example, one of our regions has adopted a new scheduling process, learned from the other area, and that has significantly expanded access to MRI services. It's a great best practice. Vice versa, the other area learned some processes related to price transparency and ensuring our patients were treated compassionately and appropriately regarding the bills. So in all of this, we are getting better because we are sharing best practices, we're collaborating, and we're applying that common purpose of passion to serve people.
Okay, then let's get to those 5 skills for successful integration. You said that the first one was be clear about expectations and the operating model. I get the feeling that you know the difference between being clear and not being clear. Care to elaborate?
Yeah, so when we came together, our goal was to make health better. And we knew that it would take a lot of work and much change to achieve this. And the most important element that you must consider embarking on any change, whether it is big or small, is that you must have trust. And that's where clarity comes in. And that trust is built from transparency, from follow through, and compassion. And so we had these 5 key lessons. And the first one is operating model and expectations. And with any integrations, it's really important to be clear about what you want to do and then follow through. And I see in many times these are integrations, they're vague on what the organization will do. And thus the follow through is not as or focused, or it could be a surprise. So the first one is we need to be really clear about our operating model and our expectations. At the basic level, our operating model is a fully engaged systemness framework where we are all working together in a highly functioning matrix format. Now that's challenging for sure, but it's helpful to get us all working together for a common purpose. And that systemness operating model means that we are one, that we have a preference for one platform, one ERP, one enterprise resource platform, one instance and build of Epic, one benefit plan, one communication tool, and so on. To do that, it means giving up some uniqueness, some autonomy, and embracing that we're going to work together collaboratively to serve our communities versus competing. And so that's hard to change, but it's extra hard when we add in a commitment to value and our integration and our integrated value component with our health plan too. So these decisions are not easy, but they are necessary to launch our systemness operating model. And so we had to be really clear about what those expectations were pre the integration and then continue to communicate on those after the integration. We can't sugarcoat it or overpromise. We need to make sure that we're being transparent and clear about what's going to happen.
Well, it's certainly better to have these issues addressed before midnight rather than after midnight. So I know that that's a very important thing that you emphasized. The second skill that you brought up is over communicate and over listen.
Yeah, so the second area is really critical. If we want to be successful, we need to make sure that we are over communicating and over listening. For example, we must ask for advice and opinions of our team members, and we have to actively use it. It doesn't do any good if we don't use it. And so an example of this is that we engaged our teams early on in our discussions about the culture to help us understand what are the traditions, what are the rituals, what is even the language that we should be using or that we should understand about the different organizations. We also asked our members about their advice for our name. We did a large survey and we said, should we stay with our existing names or should we choose something new? And 60% said, let's go with something new. And I'm really proud that the name Corewell came from that team member input. So we continue to be focused on over communicating and over listening with rounding, with new forms of connecting, and even some fun experience like doing a hot wings challenge to engage people in the communication and the listening format. So this is one that's never done, but it's one that's so critical to get the message out and to bring us together as an organization.
Third on your list was make decisions and move on.
Yeah, so once you get that input, you have to act on it. We could have dilly-dallied on choosing the name or trying to make everyone feel comfortable with not choosing one of those current names, but we knew that it would be a hard decision at that moment, and it would be a hard decision 6 months from then. So make the decisions and move on. Still gather the important information to ensure that the change management and the implementation plan works well, but don't second guess your decisions if they are really based on good intelligence.
Fourth is be comfortable with tension.
So Tom, you and I have talked a lot about being comfortable with tension. We have had a significant amount of tension in a good way because we have both care delivery and health coverage. So let's take a hot topic for today, prior authorizations. Patients don't generally love having to get prior authorizations. Physicians don't love being on the phone with a health plan asking for permission. That isn't why a physician went to medical school. And health plans, they use prior authorizations to appropriately reduce utilization for their clients, like employers and government, because they've been asked to reduce the cost of healthcare. So no one really loves them, but it's part of the business to achieve affordability in healthcare. So naturally, you could think that there's this tension between care and coverage within our organization when we talk about this. But we are refocusing the question and making sure that the question is the right question. Is it about prior authorizations, or is the question, how do we help patients receive the right care at the right time, at the right cost, in the right place? And when we reframe that question and really get at the heart of the issues, all of a sudden these new ideas flow and we can provide better care and coverage. So as we're navigating that tension of integration, we are using these same principles and reframing the questions to what matters most. What do the patient or the person need to receive and access the best healthcare across our state? How do we improve the health of individuals and the health of our community? And we're getting great responses from our team. I love the fact that we have the ability to share best practices with each other. For example, physicians from across the state are collaborating and they're elevating each other to be better, which brings even better care to our community. We just saw this with some innovative technology that uses pulse electric fields to address atrial fibrillation. And the procedures are taking place across the system from the various regions, and it's the direct result of our physicians working together. So we want to make sure that we provide the best solutions for the people that we are serving. And sometimes it takes getting comfortable with that tension, that you have to really push to find out what the right question is, to then figure out how you create a win-win from there. But in the end, we're putting our people first, we're putting our patients first, and we're putting our teams first.
And the fifth of the skill was move fast.
Yeah. So people are counting on us to make health better, and I don't want to waste a minute on disappointing them. There's so much that we need to do, and we must keep moving. Healthcare is notoriously slow to change. Many organizations don't move fast enough, and so we're really focused on how do we move fast so that we can ensure that we're providing better health, better outcomes to the people that we're serving. For example, we are implementing one Epic ecosystem within 30 months, which is a record time. We approved the plan within 3 months of organizing as an integrated system. We could have spent 2 more years of working on the one Epic ecosystem, but that wouldn't have created cultural cohesion and it wouldn't have delivered a better health experience for the people that we're serving. So we have to move quickly to get to the promises that we said we would achieve. Calculated risk. Sometimes you have to move fast to go slow. Sometimes you have to go slow to move fast. And that's part of the role as a leader, is to adjust your pace there. But it's important that you move quickly to implement these programs and don't waste any other time, because you need to make sure we're serving our communities.
Well, Tina, I really do think that these 5 skills represent a really valuable checklist. They're for leaders who are taking their organization through anything important. They can ask themselves, are we doing 1, 2, 3, 4, and 5? And if they're not, perhaps they should. And I don't think this just pertains to a merger setting. So thank you for sharing them with us. And my guess is that you will be using all 5 of these in the course of the rest of your day today and the rest of this week.
You're absolutely right, Tom. All 5 of these are about building trust through transparency, through actions, through consistency. And we can see the results coming through, not just within the integration, but in our everyday objectives and goals that we're trying to achieve. And what's amazing is that we're seeing it with patient care. If I can just close with a story about Ava, her experience shows the benefit of our integration and how it helped that we were collaborating, that we were moving quickly so that her care was well coordinated across the entire system, and she didn't need to worry about that. She could focus on her treatment, on getting well, and now she is. And so it's about being together, and making sure that we are living up to our promises.
Thank you so much, Tina.